Hi, Miss Mimosa.
Francis.
Hi, Francis. Nice to meet you. My name is Angela. I'll be your student physical therapist evaluating you today. You doing okay?
I mean, I've had better days.
Well, I guess that's why we're here, right?
Mm-hmm.
Okay. So, have you had physical therapy before?
I mean, been to OT before, same thing, right?
Kind of the same, but there's definitely some different aspects of it. So, well, I'm not quite sure how they did it in occupational therapy, but to let you know, in physical therapy, we're going to start with a brief little interview. I want to get to know you. I want to get to know what symptoms you're dealing with, and then we're going to do a physical examination.
And then, when am I getting my massage?
Well, we'll see if that's appropriate. As I kind of get to know what's going on with you, we'll see if it's something that might help you. Okay?
Say so.
Okay. So just to get to know you a little bit, can you tell me what you do for a living?
Well, I'm a customer service rep at West Telemarketing.
Okay. And what does that involve exactly?
Answering stupid questions from stupid people. But you know what? When someone tries to disrespect me, you don't disrespect me. I get to have fun, and they wish they didn't have me answer that phone.
What is so you're sitting, or I'm assuming you're sitting at a desk all day taking calls?
Most of the day, I have a dumb boss that says do this and do that, but I mean, I just sit there, wait for someone to ask a stupid question.
So would you say, has your injury affected your work at all?
I mean, I hurt my leg, not my mouth, so I don't know how that would freaking go together. No.
Okay.
Oh, that's
So
a
no
dumb
issues.
question. Take that question out. Don't ask people that. Obviously.
Well, tell me a little bit. What do you do for fun when you're not at work?
I really like to watch like vampire stuff. Like I like seeing someone get the life drained out of them. You know, like the old school vampire death. But I don't like that Twilight stuff. It's too fake. It just makes me laugh.
Well, what's your favorite? I don't catch many vampire.
I don't really have a favorite as long as people die and it's like realistic. Like I don't want blood gushing and people dying, but who falls in love and like meets a werewolf? I know. I wasted my time. I'll watch like 2 minutes of it.
It's not really a vampire movie if that's the case,
It's
right?
a waste of an hour of my life.
Was there anything that you do to stay active?
I mean, I go to crab.
Okay, that's like martial arts or something.
Yeah, basically I just beat up on some like some bags, and I can't beat up on people, I guess. But it's a good workout. I go about 2 to 3 times a week. It's like I got my abs and my glutes looking good. You didn't get to notice because I was sitting in nice glutes.
Would you say that it's very intense?
Oh, it's a full body
It's a
workout.
full body workout.
Like I have abs upon abs upon abs.
That's fantastic.
Well, I mean, it's gonna be affected because I'm not there now, but
We'll do our best to get you back. Do you do anything, any community involvement activities?
no.
No.
I don't like these people. Why would I want to help them? That's a funny question. Take that question out too.
So tell me, where are you feeling your pain?
It's like the back of my right leg, like my hammies.
And is that the only place you're feeling pain?
Mm-hmm.
Okay, so nothing in your foot,
No.
nothing in your ankle.
No.
What about the back of your leg at all?
No.
No. The front?
No.
Knee?
No.
What about the...
Ah! Gotcha. No.
Oh, that was good. You scared me.
No, you didn't even touch me. You gotta be on your toes. You didn't even go to crab.
I see that now. I'm going to put that in my chart. That's a
Go
no.
to crab.
Okay, I'll remember that.
Okay, sorry. Go ahead.
What about your hip? Any pain in your hip?
Mm-mm.
What about the back and your behind? What about the back of your back?
Mm-mm.
Okay. What about your right side? Anything in your feet,
Nope.
ankles, legs? Nothing.
Nope.
Front leg, back
No,
leg.
not my tongue, not my nose.
Well, that's good. So just
Just
your
making
back.
sure.
Yeah, we got to cover all our bases here. So I marked this on your chart right here, that this is where you're feeling your pain. Would you say that that's correct?
I mean, my glutes look better than that, but yeah, I guess it's as close as it's gonna
Well, we have to use a generic person, so it can't be quite as accurate as we'd like to be. So just to get a better understanding of your pain, right now, if you were to rank it on a scale of 0 to 10, where 0 is no pain at all and 10 is the worst you've ever experienced, what would you say?
be. Now, like a 6.
6. Okay. And what about when it's at its best?
4.
What about when it's at its worst?
12.
12. So so I said that 10 would be the most pain you've ever experienced. So would you say it's a 10?
Are you saying that I don't know what a 12 feels like? Because that's what my pain is.
Well,
You don't know me. You're not me. That's how I feel.
If you feel
Write down 12.
12 is going down.
Did you write it?
I just wanted to confirm.
So the people thinking like, they know me.
Well, that's why I have this interview, so that I can get a good understanding of what's going on with you. So
You wrote down 12 though.
I've got 12 down. So with that pain in the back of your leg, are you experiencing any numbness or tingling?
Mm-mm.
How about any throbbing sensations?
No.
Okay. And what words would you use to describe your pain?
Stupid and achy and words I shouldn't even say to you. But
Achy. All right, so,
are we gonna get a massage yet?
well, I'm still working through figuring out what's going on. So, as we progress, we'll see if that's an option.
I just hate to ask. They just said you have to go to PT, so I can get a darn MRI, and I just thought I'd get a massage. I googled it. So PTs get massages.
Well, and that can be a part of our treatment, but depending on what's going on, we want to make sure, sometimes a massage can only treat your symptoms, and if there's something that's causing these symptoms, then when the massage stops, the pain will come back. So we just really want to get down to the bottom of exactly what's going on so that we can, keep it so that you don't have to come back to PT and you can just spend your afternoons going to Krav Maga instead.
Okay.
Make sense?
Yeah.
Okay. So, is there anything that you do that makes your pain worse?
Like walking. I don't even think I can walk out to my car 2 minutes and I'm freaking hurting.
In 2 minutes. And what do you do to make your pain feel better?
Ice, rest. Ooh, I pop meds like candy. I'm the candy man.
So, how long does it take roughly for you to feel better once you've taken your medicine or rested?
Half an hour.
So, when you first wake up, how does your pain feel?
I mean, it hurts, but not bad.
Not bad. Okay. And what about as you go throughout your day?
I mean, it feels like I was hit by a truck, just stomped on. It's terrible.
Awful. Okay. Would you say that's roughly when you hit your 12 out of 10 pain?
Oh, yeah.
Okay. And at night, how does it feel?
I mean, it still hurts, but not that bad. I mean, better than now.
Better. Okay. And does your pain ever wake you up at night, keep you from going back to sleep?
Oh, just my stupid neighbors. Like, they're up all night talking about range of motion. Girls, right? Always talking about take your shoes off. And then, like, they're psychotic because one of them calls himself Mr. Cajun. I'm like, they think I'm crazy.
Those are some
I need to
strange
move.
neighbors.
I don't know. Like, they're two girls. They just moved in a month ago. Like, they need to, like, get a man or something.
Huh,
Nothing
these
better
sound
to
like
do.
characters.
Mr. Cajun.
So, I was looking over your history form here, and I see that you broke your hand a couple years ago. Can you tell me a little more about what happened?
I punched a wall. Like, I didn't, like, hit something mentally. Like, I punched a wall because stupid people all around me were being stupid. And, I mean, I can't hit someone else and go to jail. So I hit the wall. And then I had to have surgery. And the stupid doctor sent me to dumber OT with the worst breath. Didn't know what he was doing. Hurt me. Annoyed me. Like, I considered punching him and breaking my next hand. But
That must have been a really frustrating situation for you.
no idea.
Well, I certainly hope that your experience with PT will be much better.
I will never go back to Dr. Brown.
Well, has your pain gotten better with your hand?
I mean, it hurts, like, when I'm punching bags, but I talked to the doctor, and he was like, that's because you punch too much. I was like, well, stop complaining, I'm not punching you. So he just tells me to ice it, but sometimes it really hurts.
Okay. Well, if it continues to hurt, it might be worth seeking, maybe if you don't want to see Dr. Brown again, seek another doctor's opinion and see if there's something that you can do about that.
Anybody other than Dr. Brown, this man, like, ugh! Gosh, I'm sorry.
You're
I'm
fine.
sorry.
You're
This
fine.
man gives me goosebumps.
Sometimes, you deal with frustrating people. That's how it goes.
I'll never go back.
Well, I see here that you check that you have bipolar disorder. Is that correct? Okay. Do you take any medications to manage that?
Yeah, I got them right here. I mean, we gotta hurry though. I gotta get going soon. So is this almost done?
Yeah, we're getting there. Just a couple more questions.
So I take this when things get really bad, like people are stupid, people are just oof. And then I take this. I'm supposed to take this every day, but I mean, who cares, right? I've been on it so long, but I take it a lot.
Okay.
So this one's like my everyday. The other one's like help with the anxiety. I call it the stupid people pills.
Well, do you drink or smoke or anything?
I don't smoke, that'll kill you. But I drink like a glass of wine a night just because a glass of wine keeps Dr. Brown away, right? Have you heard that?
I haven't. It's very
Quote it,
creative.
put it on your wall because I swear that man walks in here. He doesn't work here, does he?
No, he doesn't work here now.
Oh, I'm about to punch him in the wall.
So, did Dr. Brown or your referring doctor, did he order any x-rays or any?
Dr. Brown don't know what to do. He don't know what he's doing. Just no tea. The doctor, though, he got me an x-ray. He said it was fine, but he said, I really want an MRI because, you know, you get to go in there and be like a robot. But basically, he goes, I have to go to PT first because he's cheap.
Okay, well, and we may be able to take care of things without the need for an MRI, which would be fantastic in the long run, don't you think?
Whatever you say, Angela.
Are there any other medications that you're taking right now?
I mean, I take everything that I can see. I mean, I'm on Advil, Aleve, Tylenol. I take it all. You name it, I got it. You want some?
I actually am not
That was a
experiencing
joke.
anything
That was a
today,
joke.
so.
I don't do that. Gotcha.
So the pills that you're taking, I mean, you take everything. Is there any consistency to it? Do you follow a schedule?
I just pop them.
Okay. So when you're going to your Krav Maga classes and your instructor might be teaching a new skill, how does he teach that is best for you? What does he do?
You have to like show me, but if you like tick me off, like I'm leaving. I can't.
Okay, so stay calm, but demonstrate. Would that be correct?
Yeah.
Okay. Is there anything that he does when he teaches that just doesn't make any sense to you?
Yeah, like he's looking over here, looking over there, talking to Sally, talking to Jill, you know, and I need to be focused. I need it quiet. I read a book every day about how to be a better person because, you know, I am a pretty good person, but we can always improve. And so I'm reading it, and the girls next door are so loud I can't focus. Something. I'm sorry. I'm not mad at you, Angela. I'm just like these neighbors and these stupid people
You're
have
fine.
a long day.
I can assume that would be quite frustrating to hear day in and day out.
Are you sure I can't get a massage?
So I can't guarantee at this time, we're almost done with my questions and we'll kind of make some decisions from there.
I mean, isn't that what you went to school for? To give massages?
Well, that's a part of it, but there's a lot more that goes into PT as well.
Sure wasn't that hard.
So, can you tell me a little bit more about what happened?
I was trying to kick my nephew. He dunked, little 8-year-old, and it hurt, period. I was going to kick him all the way to North Carolina, but that didn't happen. So now he's sitting here laughing, running around without being kicked, but whatever.
Did you feel your pain, like, when you missed his kick? Like, where at that point?
Like, the moment I was going to hit him head on, that's when the pain hurt. Like, I was bracing myself to, like, I don't know why people on the shoulder.
So, have your symptoms changed from when you kicked your nephew?
It still hurts.
How long ago did that happen?
I don't know, not too long ago. I can't give you a rough
Okay.
few days.
Okay.
A lot has happened. I've dealt with a lot of stupid people. Are we almost done? I gotta get going, man. I have like a minute.
Just a couple more questions. Have you had any issues with your leg before?
No.
No? Okay. And at home, did you have any trouble getting around?
Sometimes getting up the stairs, but it's not that big of a deal. I get up. I had a crutch, but I'm trying to look good for the guys. So basically, I used it to throw the cat.
Do you live with anyone else?
No. Just my apartment neighbors have these stupid cats always around. Hate cats.
Okay. So, what are you hoping to get out of physical therapy?
To get better.
To get better. In the end, that's all that matters, right?
Yep.
Is there anything that makes you nervous about physical therapy?
Not getting better.
Not getting better. Okay, so my number one goal in any situation is to
I'm
get
sorry,
you better.
Angela. Can we get going?
Well, actually, that's my last question. So if you're ready, we can go ahead and hop up and I'll start the physical examination.
Perfect. Thank God.